Hi, I'm Destiny Pfeiffer, and I'm introducing my new podcast series, Confessions of a Former Healthcare Worker. My new podcast is going to explore the world of healthcare. I have over 20 years of experience from working in home health to working in nursing homes, hospitals, and doctor's offices. During my podcast, I'm going to be exploring a memoir that I actually wrote um, 4 years ago, and that talks about what goes on behind the scenes. I don't think that many people realize um, just what goes on in these different healthcare settings. From working in people's homes, doing personal care, to working in nursing homes and having to deal with a lot of different patients, to working in hospitals. I was what they call a PCA, but is also known as a nurse's aide. So I worked under the doctors and the nurses, and I was the eyes and the ears for the nurses. I did patient care. I often took care of 12 to 15 patients. I worked in that job doing a variety of different medical um, skills. I have different medical skills, but I took vitals. I did bladder scans. I removed IVs. I changed patients. I worked with patients in isolation units, and I also worked with combative patients. And in my podcast, we will be talking about combative patients because that has become an issue that is very important because many people have ended up injured or have lost their lives dealing with combative patients. It's a very dangerous position. When I was a PCA, I had to work one on one with certain patients, and I was abused, and I still have the scars from that. But I also think it's an important learning experience, and something that people really need to realize goes on. It's a lot different when you're a patient in the hospital to when you are working in a hospital taking care of people. Um, I dealt with, I had a code blue that I was a part of. One of my patients coded. That was a very frightening experience. And unfortunately, I had to leave the position due to being injured. I am going to go into that further of what goes on behind the scenes in that environment. I'm also going to talk about what goes on in doctor's offices. I unfortunately just lost my job working at a doctor's office. It wasn't a good fit for me. It is a very, very hard and can be very, very complicated. I know those who have worked in that industry, like worked in doctor's offices for years. For them, it's easy. For me, it was a hard thing. But I am going to explore that more, and I'm going to also explore what it's like to do personal care for family members. As the past several years, I did personal care for my mother who has severe Parkinson's disease. I had to leave that position because it was, doing a number on my physical health. And it was kind of putting a little bit of a wedge between me and my mother. So I'm definitely going to explore that a lot more. Sorry about the lighting. My first podcast in this. But I am definitely going to go over what's in my memoir because to get a memoir published when you're unknown, even though I am a published horror novelist, to publish a memoir, you have to be very well known in the industry. That is something I'm not, and that is the reason I am doing this podcast so that I can let people know exactly what it's like and how difficult it is, because I don't think that patients realize just how stressful working in healthcare is, especially when you do personal care and when you're working one on one with patients, even if you're just checking patients in and out at doctor's offices. There's a lot that goes into that, and I'm going to explore that further in my new podcast. So I invite everyone to check out my podcast. This was my just hello and giving you kind of an update on what it's going to be about. And I hope you guys will tune in. I will talk to you later. Thanks.